Hello everyone, this is Maria and we will have a segment of Rationalize with me. Today, we will rationalize 5 questions in fundamentals in nursing. Are you ready? Let's begin! When we see scrotal edema, there is swelling caused by too much fluid trapped in the body tissue. So as a nursing intervention for edema, we should elevate the affected part by putting a folded towel under the scrotum that will provide comfort to the patient by reducing the tension and pressure, and it will promote healing by draining the fluid and allow the blood to flow, making the patient feel better. When giving an injection to a patient with a bleeding disorder where blood cannot clot properly, it is essential to take extra precautions to minimize the risk of bleeding, bruising, and other complications. Using small gauge needle minimize tissue trauma since it has a thinner diameter, which means smaller puncture wound in the skin and tissue. It will also provide less discomfort and reduce the risk of hematoma formation since it decreases the likelihood of damaging blood vessels. Applying pressure to the injection site for an extended period, typically 5 minutes, prevent hemorrhage, ensuring that any minor bleeding is controlled and minimized. It also reduces bursting, keeping blood within the blood vessels. Platelets, also known as thrombocytes, play a crucial role in the process of homeostasis, which is the body mechanism for stopping bleeding and maintaining vascular integrity. It contains clotting factors and enzymes as well as protein. They are the first responders to the site of injury, adhere to damaged blood vessels, aggregate forming a plug that serves as seal, releasing clotting factor, and promote fibrin formation is essential for the formation of blood clots, which are crucial for wound healing. To insert a nasogastric tube, the nurse instructs the patient to tilt the head back slightly and then insert the tube. To facilitate the passage of the tube through the nasal passage and into the throat or pharynx. When the nurse feels the tube curving at the pharynx, the nurse should tell the patient to tilt head forward to close the trachea and open the esophagus by swallowing. Sips of water can facilitate this action since it initiates the natural swallowing reflex. This is important because you want to ensure that the tube is directly into the esophagus, which leads to the stomach, and not into the trachea, which leads to the lungs. It is a precautionary measure to reduce the risk of the tube entering the respiratory tract that could lead to complications like aspiration pneumonia. Families with loved ones in ICUs are going through emotional challenge and stressful experience. Meeting their needs for honest communication gives them clear answers that could build trust, reduces uncertainty, and allows them to actively participate. ICU patients often require complex and specialized treatment. Knowing that their family members in capable hands can alleviate anxiety and help families feel confident in the care being provided. It is to mentally prepare them for what lies ahead. Understanding the severity of the condition, potential complications, and expected outcomes can help families set realistic expectations. Healthcare providers should convey that medical interventions are being undertaken to optimize the patient's chances of recovery and that the healthcare team is committed to providing the best care possible. Effective communication and compassionate approach make a significant difference in the overall experience for families during challenging times. That would be all. Like, share, and subscribe for more nursing videos. Bye!